Have you ever found your mind just buzzing? When you really, really need to focus on just one thing, but it feels impossible.
Or maybe it feels like your brain is this huge, noisy train station, dozens of conversations happening all at once, and you can barely hear yourself think.
Exactly. Well, today we're doing a really important deep dive. We're getting into a topic that affects millions of people, but honestly, it's still widely misunderstood.
That's right. We're talking about attention deficit hyperactivity disorder, or ADHD.
And our mission for this deep dive is to really unpack the latest science behind ADHD.
Yeah, we want to look at what's actually happening in the brain, challenge some of those, persistent myths that are out there.
And share practical strategies backed by evidence.
And these aren't just for folks with an ADHD diagnosis. These are actually tools for, well, for anyone looking to sharpen their focus.
Hmm?
Let's face it, we live in a super distracting world.
We really do. And you might find yourself listening and nodding along, maybe recognizing some of this in your own life or perhaps in someone you care about. This isn't just about labels, is it? It's about getting a much deeper understanding of how human attention works for everybody.
Absolutely. We'll share some powerful insights, some really actionable tips you can genuinely use.
And remember, if you want even more detailed resources, more support, you can always check out my website. It's www.babykidshealth.com. We really want to help you thrive.
That's like a great resource.
Okay, so let's kick things off by tackling some common ideas about ADHD, because it's probably a lot more nuanced than many people think.
Yeah.
For ages, the stereotype was basically, oh, ADHD means you're not smart or you're just lazy, not trying hard enough. What does the actual research say now?
That's such a critical point to hit right away. Research overwhelmingly shows that's just completely false.
Right.
You find people with ADHD across the entire IQ spectrum. High, low, average.
Yeah.
It has absolutely nothing to do with intelligence.
Okay.
Instead, experts now describe ADHD more as a challenge with regulating attention. Not a deficit, not a lack of it, but trouble managing it.
Regulating. Okay, how does that work?
Imagine, like, you're trying to tune into a radio station, right?
Mm-hmm.
But the signal keeps fading in and out, or maybe 4 different stations are all trying to come through at once. It's really hard to separate the important stuff from all the noise. That's kind of how the brain with ADHD often experiences the world around it.
That analogy really helps. It reminds me of the story I heard about a hockey goalie, incredibly talented, tested way up in the superior range.
Okay.
On the ice, unbelievable, never missed a thing, always knew where the puck was. But in the classroom, totally different story. Staring out the window, completely disengaged.
I can picture it.
And teachers would say, look, if you can pay such close attention playing hockey, why can't you pay attention in my class? And his answer was brilliant.
What did he say?
He said, if it's something I'm interested in, I can pay attention. If it's not, I just can't. It nails exactly what you're saying, doesn't it?
It absolutely does. For someone without ADHD, even if a task is boring, they can usually consciously direct their focus because they know it's important, right?
Yeah, you just buckle down and do it.
But for someone with ADHD, that internal drive, that ability to make yourself focus on something you don't find inherently interesting, it's incredibly difficult to access.
Wow.
It takes this huge, often really exhausting amount of effort. And that leads to another key point. ADHD isn't like pregnancy. You either are or you aren't.
Right, it's not black and white.
Exactly. It's much more like, say, depression. Everyone feels down sometimes, right? But for someone with clinical depression, it's way more frequent, much more intense, more impactful.
Okay, I see the parallel.
Similarly, lots of us struggle with focus now and then or getting organized. But for individuals with ADHD, these challenges are significantly more persistent. They're pervasive, they show up everywhere, and they genuinely impair daily life.
So it really exists on a spectrum, and it sounds like this isn't just about habits or effort, it's something deeper in the brain itself.
Oh, absolutely. This difference in attention regulation, it isn't a choice people are making. It's profoundly rooted in how the brain is actually wired.
Wired differently.
Yes. There's a strong biological and genetic foundation. It very often runs in families. Research points to specific brain areas, like the prefrontal cortex.
What's like the brain's CEO, right? Planning, decision-making.
Exactly, the executive control center. And in ADHD, that area might develop differently, or perhaps its development is delayed compared to neurotypical brains. It's about the fundamental architecture, not willpower.
Okay, so if the wiring is different, let's talk about the brain's conductor. What's sort of orchestrating these differences in focus and attention?
This is where it gets really fascinating. It comes down to neurochemicals, particularly a crucial one called dopamine.
Dopamine, we hear a lot about that.
Yeah, and for good reason. Think of dopamine as the brain's conductor. It helps orchestrate how all the different brain networks involved in attention work together smoothly.
How does it do that?
It helps create that state of heightened focus. It sort of narrows our visual attention, our auditory attention, almost like shining a spotlight on what's important and tuning out the rest.
Okay, so if dopamine is the conductor, what's going wrong? Or differently, I guess, in the ADHD brain's orchestra?
Well, the leading idea, often called the low dopamine hypothesis, isn't necessarily that brains with ADHD don't make enough dopamine.
Oh, okay, so it's not a lack of production.
Not necessarily. It might be more about how effectively they release it and then reload it. Imagine tiny little vacuum cleaners at the synapse, right? They suck back the neurotransmitters after they've set their signal, getting things ready for the next message.
Okay, the cleanup crew.
Exactly. And in ADHD, that cleanup and reload process might not be as efficient. It can lead to a less stable, less targeted flow of information. You might get neurons firing unnecessarily, things not related to the task at hand.
Which makes it harder to stay focused on the main signal.
Precisely. It makes it much harder to maintain that clear focus signal amidst all the internal and external noise.
That really connects the dots between the brain mechanics and the experience.
Okay.
So understanding that, what kind of behaviors might we see? Are people instinctively trying to manage this?
That's a great question. Given this neurological difference, you often see individuals with ADHD instinctively seeking out behaviors that give them a quick dopamine hit.
Like what kind of things?
It could be a natural pull towards sugary foods, for example,
Mhm.
or sometimes things like coffee or other stimulants.
Trying to boost focus.
Often, yeah.
Yeah.
It's frequently an unconscious attempt to kind of self-medicate, to get that conductor to lead the orchestra a bit more effectively. You know, studies have shown kids with ADHD are often drawn to sugary stuff, maybe trying to get that little burst of focus, however fleeting.
Wow, that's a really powerful insight, thinking about it as an attempt to regulate rather than just a craving.
Exactly.
Okay, so with this deeper understanding of the brain wiring and chemistry, let's explore how this actually plays out day to day. What are some common challenges people with ADHD face?
Well, one of the biggest areas involves what we call executive function challenges.
Executive functions. Those are the brain's management skills, right? Planning, organizing.
That's it. Crucial for planning, organizing yourself, self-regulation, initiating tasks, all that stuff.
I think we all struggle with organization sometimes, but it sounds like for ADHD, it's more intense, like getting organized and just starting things.
Precisely. It often means real trouble organizing physical belongings.
Hmm.
You mentioned the pile system earlier. That makes sense only to the person who made it.
Guilty as charged sometimes.
But also managing time effectively and critically, just getting started on tasks, prioritizing, initiating. It can be a huge struggle. Procrastination often happens until something becomes an absolute emergency.
And it's not because they don't want to start.
No, not usually.
Yeah.
It's more like a fundamental challenge in the brain, activating its start button for tasks that aren't immediately stimulating or interesting. Even simple first steps can feel overwhelming.
Okay. And what about keeping going? Finishing what you start?
That's another common one. Sustaining effort. Someone might start a new project with tons of enthusiasm.
Yeah, all fired up.
But then find it incredibly difficult to maintain that consistent effort needed to actually finish it in a reasonable time frame. This can lead to that hurry-up slapdash approach at the very last minute, or just loads of unfinished projects.
I've also heard that putting thoughts into writing can be particularly tough.
Yes, many people describe significant challenges just organizing their thoughts into coherent sentences and paragraphs. It can feel like writing takes, half a forever, even when the ideas themselves are clear in their head. Getting it out in a structured way is the hurdle.
And time. You mentioned time management. It seems like the perception of time itself can be different.
Very much so. We sometimes call it time blindness. Individuals with ADHD often really underestimate how long tasks will take.
Leading to being late.
Frequently, yeah. Unless there's a really severe immediate deadline creating intense pressure, running late can be a common pattern. It can be frustrating for them and for the people around them, obviously.
Does memory play a big role in the challenges?
Well, it's usually not about long-term memory. People with ADHD often have vivid recall of things from years ago. The bigger challenge is typically with working memory.
Working memory.
Well,
what's that exactly?
It's the ability to hold information in your mind while you're manipulating it or doing something else, like walking into a room and completely forgetting why you went there.
Oh, okay. Happens to everyone sometimes, but maybe more often.
Exactly. Or trying to remember 5 items you need at the grocery store, but you only come out with one because the list just vanished from your mental notepad. It's keeping things active while you're engaged.
And what about the emotional side of things? You hear about emotional intensity.
Oh, absolutely. It can be a real roller coaster. Intense emotional responses are very common. A small frustration, something most people might rate a 0 or 1 out of 10.
Yeah, but barely a blip.
For someone with ADHD, it can feel like a 7 or 8 instantly. You might see sudden surges of anger or this relentless push to get something right now, even if it's inconvenient or expensive.
Impulsivity, maybe.
Partly, yeah. And worries. Worries can become incredibly vivid, like playing these detailed, consuming movies in the head where a small concern just spirals into this elaborate worst-case scenario that feels intensely real.
So it's way more than just not being able to focus on homework. It's managing these really powerful internal states, too.
Absolutely.
Huh.
And then there's the action management
What
piece.
does that look like?
It can manifest as physical restlessness,
Yeah.
constantly needing to move, fidgeting,
Yeah.
or impulsivity in speech, blurting out answers before someone's finished asking the question.
Okay.
There's often this internal uh, reverberatory activity, like a humming or buzzing inside, that makes just sitting still incredibly difficult. That's why you see kids, and adults too, needing to fidget or move. It actually helps them channel some of that energy so they can concentrate better.
That makes sense. And sleep. I hear that's often a big one, too. The night owl phenomenon.
Oh, definitely. Many people with ADHD are night owls. They feel wide awake, their minds are buzzing, just when everyone else is winding down for the night.
Why is that?
They often struggle to shut off those busy thoughts at bedtime. It leads to staying up late and then, of course, having a really hard time waking up in the morning. For some, the quiet of the night is the only time they feel they can get uninterrupted focus, whether it's for worries or creative bursts. So it's hard to switch off.
Okay. This next part is where it gets really interesting, I think, for absolutely everyone listening. Whether you have an ADHD diagnosis or not, we're talking about focus in our modern world. And there's research suggesting that our constant smartphone use, the endless scrolling, the rapid switching between apps, the notifications, it might actually be inducing a kind of ADHD-like state in all of us, eroding our ability to pay attention.
It's a huge concern, honestly. Experts are increasingly suggesting limits maybe less than 60 minutes a day of smartphone use for adolescents, perhaps around 2 hours for adults if maintaining sustained focus is a goal.
Wow, that's not much in today's world.
Yeah, it isn't. But the brain really struggles to shift gears from that constant, rapid turnover of context you get on a phone, multiple apps, social feeds, dings and buzzes, back to deep, sustained work on a single task.
It makes everything else feel slow and boring by comparison.
Kind of, yeah. It makes it harder to do that meaningful, focused work. And that affects everyone's ability to concentrate deeply, not just those predisposed to ADHD.
This all just underscores how powerful understanding this is. What happens when ADHD gets missed? When it's overlooked or undiagnosed, especially maybe for people who don't fit that classic hyperactive boy stereotype?
Unfortunately, it happens all too often. ADHD is frequently undiagnosed, especially in girls. They might be seen as daydreamers or maybe chatterboxes rather than showing those more obvious hyperactive symptoms.
So their struggles are internalized more.
Often, yes. And adults, too. Many adults develop these really intricate coping strategies over the years. They manage to mask their symptoms, but it often comes at a tremendous personal cost. Huge amounts of effort, constant internal struggle, sheer exhaustion.
And the impact of going through life not knowing you have ADHD, it sounds like it could be pretty profound.
It truly can be. Undiagnosed ADHD is linked to significantly higher rates of other challenges: depression, anxiety, lower self-esteem, and often increased substance use. Sometimes is that unconscious self-medication attempt we talked about, trying to find calm or focus.
Wow.
Research also shows higher rates of accidents, lower educational attainment, more job instability, financial difficulties, and real strain on relationships. For example, some studies suggest a dramatically higher rate of undiagnosed ADHD among psychiatric inpatients compared to the general population.
That's staggering.
And a higher risk of suicide, tragically. It really highlights a massive need for better awareness and earlier identification.
Such a tough reality.
Yeah.
But what about the flip side? When someone, maybe an adult, finally does get a diagnosis, what's that experience like?
It's often incredibly powerful. One of the things you hear most consistently from adults diagnosed later in life is this immense sense of relief.
Relief. How so?
Relief from understanding they weren't just, quote, a failed version of normal, that there was a reason for their lifelong struggles. It provides this framework, this lens, to understand their entire life's experiences in a new way.
That makes sense, like puzzle pieces clicking into place.
Exactly. And connecting with others who share similar experiences. That can create such a powerful sense of belonging. It helps people recognize their unique strengths, too. It's like finding your tribe, realizing you're absolutely not alone, and finding a community that just gets it.
Finding your tribe. I like that. And this really leads us to the critical importance of catching this earlier, especially for kids. Early intervention.
Oh, absolutely crucial. Experts really emphasize the importance of early diagnosis and getting support in place, especially during childhood.
Why is childhood such a key window?
Because during those years, the brain has incredible neuroplasticity. That's its amazing ability to rewire itself, to adapt and change.
Well,
Very. So early treatment and support can literally help shape the brain's developing circuits to better manage attention. If you can help a child learn to access stillness and focus early on, the thinking is they can build on that ability as they grow. They learn what true focus actually feels like.
okay, so we've dug into the challenges, the brain science, the importance of understanding. Now let's shift gears fully into solutions. Let's talk about the toolkit for thriving, whether you have an ADHD diagnosis or you just want to seriously boost your focus. Where do we start? Medication often comes up first.
It does, and it can be very effective for many. Stimulant medications like methylphenidate and amphetamine formulations are commonly prescribed.
How do they actually work in the brain?
They work primarily by increasing the levels of dopamine and norepinephrine, those key neurotransmitters we talked about. This helps to improve focus, sustain attention, and reduce impulsivity.
So they help the conductor lead the orchestra better.
That's a great way to put it, yes. And interestingly, for many people, they don't cause more hyperactivity. Paradoxically, they often help to calm the brain, making its circuits run more efficiently.
But it's not a cure, right? You hear that sometimes.
No, absolutely not a cure. These medications don't fix the underlying brain differences. They manage the symptoms effectively while they're active in the system. It's often compared to eyeglasses.
Eyeglasses.
Yeah, eyeglasses help someone see clearly while they're wearing them, but they don't cure the underlying vision problem. Take the glasses off, the vision issue is still there. Same idea with stimulants.
Are there other types of medication too?
Yes, there are non-stimulant medications available as well. They work differently, often by primarily increasing norepinephrine, though some impact dopamine too. They can be a good option for some, perhaps those who don't tolerate stimulants well, and they generally have a lower risk of dependence.
And it feels really crucial to say here, medication should always be prescribed and very closely monitored by a qualified healthcare professional.
Right.
Discussing the individual risks, benefits, side effects.
Oh, absolutely essential. That's non-negotiable. There are potential side effects. Things like trouble sleeping, decreased appetite are pretty common. Sometimes temporary growth delays, especially in boys, though they often catch up later.
Anything else to be aware of?
Headaches, sometimes nausea, maybe a rebound effect where irritability increases as the medication wears off. In some cases, mood changes or think tics can emerge or worsen. And rarely there can be cardiac risks, which is why careful screening and monitoring are vital. It needs professional oversight.
Definitely. Okay, so beyond medication, what about practical behavioral strategies, things people can do to create a more supportive environment for their brain?
Structure and routine are huge. Establishing consistent routines for sleep, meals, study, or work times can be incredibly helpful.
Predictability helps.
Yes, it reduces anxiety and provides a much-needed framework. Visual reminders, like charts or calendars, clear boundaries, they all contribute to that structure. And when it comes to tackling tasks,
Break them down.
exactly, break big, overwhelming tasks into smaller, more manageable steps. That makes them feel less daunting. Using tools like timers, setting alarms, keeping simple to-do lists, these can make a massive difference in just getting started and following through.
That makes sense. And what about that restlessness, the need to move we talked about? Fidgeting.
Embrace it, within reason. For kids, and honestly for adults too who feel restless, fidget toys or tools can be surprisingly effective.
How do they help?
They provide an outlet for that underlying reverberatory activity, that internal buzz or nervous energy. It allows them to channel some of that movement physically, which can paradoxically help them improve focus in structured settings like a classroom or a meeting.
Interesting. And you mentioned something earlier called attentional blinks. That sounded fascinating for everyone.
It really is. It's a concept that applies to all of us. We all have these tiny moments, these blinks, where we briefly miss incoming information because our attention is too narrowly focused on something else.
Like missing the gorilla walking through the basketball game video.
Kind of like that, yes. But simple practices can help. Things like taking short periods of quiet rest, just letting the mind wander for a bit, or even consciously controlling your rate of blinking while you're trying to focus.
Controlling blinking. How does that work?
Well, the rate of spontaneous blinking is actually linked to dopamine levels. So, consciously slowing your blink rate while focusing can, believe it or not, help maintain that dopamine balance and reduce those attentional gaps, improving overall attention.
Wow, okay. Let's talk lifestyle and maybe supplements. What role can things like diet, exercise, sleep play? Are they supportive?
They can play a really important supportive or modulatory role. Diet is one area, though sometimes controversial. Some experts and many individuals observe that reducing simple sugars can have a pretty dramatic positive effect on ADHD symptoms.
Less sugar, better focus for some?
For some, yes. Also, exploring potential food allergies or sensitivities might be beneficial. Some studies have shown significant improvements when specific allergenic foods are eliminated, although more research is needed there.
What about omega-3 fatty acids? We hear so much about them for brain health.
Yes, the research there is quite promising. Daily intake of omega-3s, particularly making sure you get enough DHA, maybe 300 milligrams a day or more, seems to play a supportive role in attention and focus.
Supportive, not a cure.
Exactly. They won't cure ADHD on their own, but they can help the whole system function a bit better. Sometimes, this might even allow for slightly lower doses of medication if someone is taking it, under guidance, of course.
And exercise. Seems like a no-brainer for well-being, but especially here.
Oh, absolutely crucial. Physical activity is fantastic because it naturally releases dopamine and other helpful neurotransmitters. It has a direct positive impact on attention, focus, and managing that restless energy. Regular movement is key.
Makes sense. And sleep hygiene. We know it's important, but maybe extra critical for a brain that struggles to switch off.
Extra critical is right. A consistent bedtime routine is vital. That means things like turning off electronic devices at least an hour before bed.
The blue light issue.
Yes, and just the mental stimulation. Creating a calm sensory environment. Think blackout curtains, maybe white noise if that helps, and using relaxation techniques can significantly improve sleep quality. Tackling those busy racing thoughts at bedtime is a major goal.
And you mentioned a surprising one earlier, mindfulness or something called interoception.
Yes, a really simple practice actually, just sitting quietly for say 15-20 minutes and deliberately focusing your attention inward, noticing your breath, sensations in your body.
Like body scan.
Kind of, yeah, focusing on your internal state. This builds what we call interoceptive awareness, your ability to tune into and understand the signals coming from inside your own body. Doing this regularly can literally help rewire your brain circuits to attend better.
Rewire the brain. Seriously.
Yes, that's the power of neuroplasticity again. And studies suggest this kind of practice might even help offset some of the natural age-related decline in attention that affects many of us.
That's amazing. Okay, finally, let's talk about mindset and community. How can focusing on strengths and connecting with others help people with ADHD truly thrive?
This is so important because alongside the challenges, individuals with ADHD often possess incredible unique strengths.
Like what?
Things like profound curiosity, amazing creativity, quick wit, the ability to think outside the box, lateral thinking, often immense determination, resilience, and a real entrepreneurial spirit.
Entrepreneurial, really?
Yeah. Research actually indicates that individuals with ADHD are significantly more likely to start their own businesses. Some studies suggest maybe even 300% more likely. Focusing on these talents is incredibly empowering.
Instead of just focusing on the deficits.
Exactly. And finding that tribe we talked about earlier.
Connecting with others who get it.
It's invaluable. It provides support, shared understanding, validation. It really helps people move past self-blame and that awful feeling of being a failed version of normal. Just knowing you're not alone is profoundly healing.
That sense of belonging sounds crucial. For parents listening right now who might be navigating this with their child, what's your #1 piece of advice?
Oh, gosh. Above all else, love and nurture your child unconditionally. See the amazing person they are. Use positive language. Focus on their strengths as much as the challenges.
Be their advocate.
Absolutely. Advocate passionately for their needs with schools, with professionals. Make sure they get the right support. And really, really prioritize your relationship, especially as they become teenagers. Connection is everything.
And remember, you're not alone either as a parent.
Yes. Remember, you are your child's best advocate. You are not alone on this journey. Find your own support network. Together, we really are stronger.
Wow, we've covered so much ground today, a real deep dive. We've explored how ADHD isn't a deficit, but actually a profound difference in how the brain regulates attention.
hmm We've seen how crucial that neurochemistry, like dopamine, really is, and how a powerful combination of things, understanding, sometimes medication, definitely behavioral strategies, lifestyle adjustments, and that vital community support can unlock incredible potential.
Potential for everyone, really.
So, thinking about all this,
Mm-hmm.
what stands out to you from our conversation today? What strategies maybe caught your attention, things you might explore in your own life to boost your focus, your well-being?
We would genuinely love to hear your thoughts. Let us know on social media. Share your questions too, and we'd be happy to tackle them in a future deep dive.
Definitely. And for much more detailed information, loads of practical tips, and connecting with a supportive community around these topics.
Please, I really encourage you to visit my website. It's www.babykidshealth.com. It's packed with fantastic resources covering everything we've touched on today, and honestly, so much more.
It's a great next step, and maybe just to leave you with something to think about. As our world just gets more and more saturated with information, more constant distractions pulling at us, the insights we gain from understanding ADHD actually pose a really profound question for all of us, don't they?
Which is?
How can we as individuals, and maybe even as a society, get better at designing our environments, cultivating our own minds, so that we can all thrive in this attention-grabbing world? How do we ensure everyone, truly everyone, can reach their full potential, no matter how their unique brain happens to be wired?
That is a big question, something to definitely mull over.